Continuing debate, the honourable member for Battle River Crowfoot.
Thank you very much, Madam Speaker, and as always, it's an honour to be able to enter into debate in this place, and especially when we are talking about something as important as mental health. And Madam Speaker, I'm hearing a little bit of echo here, so hopefully that's okay for the technicians. Madam Speaker, as I've listened to much of the discourse that's taken place over the course of the evening, to hear the common agreement and of the importance to see that this issue is addressed not from a partisan way, not from a political way, but truly and meaningfully addressed. And Madam Speaker, as we look at just the pure facts, about 1/3 of Canadians face some sort of mental health challenges. So that is literally, if you look to your left and you look to your right, it is one of the three people, person on your left, yourself, or the person on your right. Madam Speaker, this is the definition of something that impacts everyone, and how important it is that we acknowledge that mental health is health, and the important distinction that makes when it comes to both addressing the specific aspects of what mental health care looks like and whatnot, but how that needs to be core in the overall strategy to which we approach it, both from the federal perspective as we partner and work with provinces, with municipal governments, and of course with the many stakeholders involved. And as we looked at the many implications that mental health has, and the consequences of when there's not early intervention and early action, we see addictions, we see suicide, we see abuse and domestic challenges, and many, many other effects that have significant impacts on every Canadian. And I say every Canadian, there's very few things that affect every Canadian, but Madam Speaker, this truly is one of them. And of course, the fact that I believe it's between the ages of 15 and 35, the leading cause of death, Madam Speaker, tragically, is that of suicide. And Madam Speaker, I know as we talk about the dynamics associated with mental health, I know we can look to family members, and I know having close experiences with some members of my family, and it is truly something that is very, very personal. And of course, the dynamics of access to things like care, the challenges associated with rural. And Madam Speaker, I wanted to, in this although very short intervention, to also talk about the fact that I'm proud to represent Camp Wainwright, a military base, and the dynamics associated with mental health. And even as we look back throughout the history of what shell shock was, and the lack of understanding around many of those issues throughout much of our country's history, but warfare in general and military service in general, but to see how important, and now having the opportunity to work with some veterans to try and help them navigate what can be a very complex system, to get the supports that they need, to ensure that whether it's PTSD or the other challenges that come along with service in the military, to make sure that our veterans, and just to note how important it is that like many of us read over the course of the summer, that a veteran was offered MAID. Madam Speaker, that breaks my heart that somebody would be offered death as opposed to hope. I hope that would be a wake-up call for all of us to ensure that we are actively working towards making sure that mental health and the care needed, whether it be for our veterans or every Canadian, is offered. So, Madam Speaker, in the minute I have left, we need to get down to the brass tacks of what we do about it. I was pleased in the last election how each and every party had a mental health plan. Now, although Conservatives got more votes, we didn't win the most seats. But I am glad that each party represented in this place did have a mental health plan. And certainly I hope that when it comes to the mental health transfer, that we can get those details sorted out, Madam Speaker, because those dollars need to get to the provinces so that they can get to the supports that are needed. We need to make sure that the 988 suicide helpline, which I am so proud to be a part, and the member from Thompson River Caribou, I believe, Caribou, Prince George, my apologies. So proud to serve in a caucus where we have that advocacy. And Madam Speaker, I wish there would be more opportunity to share the other ways that but let me simply wrap by saying this. This is a great conversation to have, but it has to result in action, and I hope we can do that together.
Questions and comments? L'honorable député de Lac-Saint-Louis.
The Honourable Member for Lac-Saint-Louis.
It's more a comment than a question. I don't want to put the member on the spot, but one thing I've observed is that there's a lot of expertise, a lot of insight in this House at the federal level into the problem of mental health. And I know that typically when we transfer funding, when we have funding for health-related initiatives, provinces will say, well, we are closer to the situation, therefore we do not want any directives associated with this transfer of funding. But this is a case where I believe that there's a great deal of expertise at the federal level, and that we should fine-tune our initiative, our transfer of funds, to make sure that all aspects of this extremely complex ecosystem that is mental health receive the measure of support that they need to be truly effective.
Battle River Crowfoot.
And I think that part of the reason is that there's so much expertise represented is because there's 338 people. By the pure numbers, over 100 individuals in this House have experienced personally mental health challenges, and we all know and have walked alongside those who have as well. There is a lot of expertise, and that needs to help to make sure that we can get dollars out the door. And I would just offer this. Healthcare in our country is provincial jurisdiction. So I hope that as we discuss both the Canada Mental Health Transfer and everything associated with a mental health action plan and everything that's needed to ensure that supports get out the door, 988, et cetera, let's not get lost in the details, but rather make sure that supports get out the door and that we work as partners, not as dictators and saying how provinces should or shouldn't spend dollars, but truly work collaboratively in a partnership to ensure that those supports can simply get out the door.
Questions and comments? The member for Courtenay Albany.
Speaker, and I think the member from Battle River Crowfoot can attest that it's very rare that we get along or find common ground on issues, but this is one tonight that I really do appreciate his speech. It was excellent. He talked about the sense of urgency. He shared his personal story a bit, his vulnerability there, and it's very generous. And we have an issue that we are seeing common around this House, and the need to deal with the patchwork of the provinces that do deliver health care and the urgency to get resources out to them. We saw that urgency when it came to childcare, but the government hasn't demonstrated that here on this issue. Now, Margaret Eaton, the CEO of the Canadian Mental Health Association, she said that even if the immediate impacts of COVID-19 are subsiding, the mental health effects persist and will likely continue for years to come. The community mental health and addiction sector cannot meet these growing needs with the current patchwork funding and disjointed service delivery model. It's time to overhaul our mental health system. Now, I can't say enough about how much...
I'm sorry, I do have to allow for one more brief question after this. I want to allow the member to respond to the comments. The honourable member for Battle River Crowfoot.
Thank you, Madam Speaker. And yes, and often we do disagree on things, policy related and whatnot, but I am so pleased, as I said, that there is common agreement. We may differ a little bit on what that action looks like, but I am so pleased that in this House, and I believe across the country, and I think if we would find, certainly as I talk to my provincial counterparts, that there is significant agreement to ensure that we simply get to work. And the consequences of COVID, certainly, although the pandemic-related measures, we're seeing those subside, the consequences of the mental health side of things are going to be long felt. That certainly has to be addressed when both developing the framework surrounding the health transfer and other related areas of policy regarding mental health in Canada.
We have time for a brief question. The honourable member for Brandon Souris.
Thank you, Madam Speaker, and I want to thank my colleague for his presentation tonight. I earlier mentioned how I didn't think we had enough resources in all across the country, but particularly in rural areas. I know my colleague comes from a rural area in Alberta. I wonder if he could expand on that as well.
To answer from the member for Battle River Crowfoot.
Absolutely. We need to ensure that rural has equitable and full access to these services, and that's part of the reason why I was so excited. In fact, Madam Speaker, I represent about 64 self-governing municipalities in rural Alberta, and the majority of them passed motions at their village councils saying that a 988, although in many cases in their debate and whatnot, they said that wouldn't be the solution. It was such an important tool to ensure that there was that consolidation of services, to make sure that especially in rural areas where you could be an hour or two from a hospital, 3 or 4 hours from a police call, to make sure that those resources are accessible with simply pressing 3 buttons on your phone. Among many other things, but certainly that's an important